we're going to jump right into it. And I'm going to do a brief overview of what our objectives are today in the hour. Um, we're going to show a brief PowerPoint presentation that's going to review the current eating disorders in the DSMs and some disordered eating behaviors that are not actually in the DSM, but are being commonly used by practitioners in the field. We're going to review myths about eating disorders and debunk them, review and provide some statistics and facts about eating disorders, and to demonstrate how pervasive this disease can be and how it's impacting communities across this country and across the world, and provide resources for folks to review and opportunities to learn more. Eating disorders are a complex mental illness, and Catherine and I do this a lot. We talk about eating disorder and eating disorder recovery. So we're going to do the best we can to give you succinct information today. And then transitioning from the PowerPoint, we're going to have a conversation, Catherine and I. One thing we've learned through our podcasting is that communication, talking about your story, providing your narrative is an effective way to heal, is an effective way to connect with others who are experiencing eating disorders and either begin recovery or continue in recovery. And sometimes it's hard to understand what that looks like. How do we talk about eating disorder recovery? How do we talk about our own eating disorders, development, recovery, transition to a life outside and after an eating disorder? And so Catherine and I are going to interview each other briefly to provide that example, something that we've had some practice doing, and hopefully it's a good resource for folks who are hoping to experience their own ability to tell their story and their own narrative. And finally, we'll take some questions at the end. So I want to jump into our next slide. So just brief overview of the eating disorders currently in the DSM-5. My suggestion to get more in depth would be, these are very easily researched online. You can do a quick Google search and find out a lot of information for each of these. Just quickly reviewing, the three main eating disorders most people hear about are anorexia nervosa, bulimia nervosa, and binge eating disorder. We also just want to briefly review other specified feeding and eating disorders, otherwise known as OSFED, avoidant restrictive food intake disorder, otherwise known as ARFID, and then really less common eating disorders, pica and rumination disorder, and then unspecified and feeding and eating disorder, excuse me. So starting with anorexia nervosa, this is someone's drive where thinness or body manipulation is really tied to self-worth. They either have a strong, significant drive to have a smaller body, and it becomes a preoccupation, an obsession in life, and really disrupts life's your ability to live any sort of life, any sort of meaningful life. People typically will enact behavior such as restriction, which can look like elimination of entire meals, elimination or avoidance of certain foods, over-exercise, purging, either self-induced vomiting, laxative use, and that would be a subcategory of anorexia nervosa, subtype binge purge. And again, body image dissatisfaction is the key here. There's a drive to be typically to have a smaller body. Bulimia nervosa is a similar symptoms, similar behaviors. The difference is categorized by binge eating prior to self-induced purging, whether that's vomiting, over-exercise, laxative use. Prior to that, there is a binge episode where either the amount of food is considered quote unquote excessive. There's some subjectivity here depending on the individual. Followed by compensatory restrictive behaviors in an effort to, again, whether it's an ideal of thinness, trying to change your body, manipulate your body, that's the goal. There's typically severe body image dissatisfaction as well, or increased fear of weight gain. Binge eating disorder is categorized as episodes of eating large amounts of food, again, subjective in nature, feeling a lot of guilt and shame afterwards, feeling out of control when eating in these episodes, and not being able to stop, feeling powerless over your ability to eat. There is no compensatory behavior associated with binge eating disorder. OSFED, I think I really wanted to point this out. We really wanted to point this out because research is indicating that this is the most commonly diagnosed eating disorder. And what folks will hear a lot is something called atypical anorexia nervosa. And really, it's not atypical at all. Anorexia nervosa, in the DSM, individuals experiencing these symptoms need to be a certain body weight, need to be quote unquote underweight, malnourished, to meet the criteria. So many individuals who have larger or fat bodies experiencing restriction don't fit anorexia nervosa, and so they are diagnosed with other specified feeding and eating disorders and called atypical anorexia, again, even though it's not atypical at all. It's in some ways why the DSM is fat phobic, and needs adjusting and needs update, quite frankly, from an eating disorder diagnosis perspective. And then there's ARFID, again, a less common diagnosis, but it's sometimes referred to as extremely picky eating. I think it's a generalization, but essentially it is avoiding and restricting certain foods, and it can happen at any age. Typically, we'll see it in younger individuals. And there's no body image dissatisfaction associated, but it can be as disruptive as something like anorexia nervosa, in terms of functioning in life and behaviorally, and then can lead to malnourishment and significant decrease in weight that can cause many physiological complications. Pica, briefly, is people experience and have urges to eat non-nutritive foods, so things like hair, etc. from there. And again, that's a pretty rare disorder. Rumination disorder, again, pretty rare, is a regurgitation of undigested food, and it will come up, and it's sort of like it is restriction in a way, and so it can lead to, again, a lot of malnourishment, significant decrease in weight, and physiological complications. And then sort of everything that doesn't fit in these criteria, and again, I'm being very brief and generalizing, fits into the unspecified feeding and eating disorder. A couple other things I just want to touch on from eating disorders in the DSM: body dysmorphia disorder, a really preoccupation with your body image, dissatisfaction with certain parts of your body to a point where it becomes obsessive, and you are not able to function day to day, not able to socialize, not able to go to work, and all of your time is dedicated to fixing that perceived flaw, whatever it may be. A subcategory is muscle dysmorphia, often seen in male presenting individuals, but across the gender spectrum, is obsession with the muscular aesthetic, and you'll hear terms like "I'm going to bulk up," and they spend most of their time in the gym, and it becomes, again, obsessive and so disruptive in life it's disordered. And then orthorexia nervosa, essentially an obsession with clean eating, an obsession with, it might be organic foods, a certain type of food, but it becomes, again, to the point where you're obsessing that it's impacting your entire life. You're not able to function, socialize, go out to dinner, whatever it may be, because you're so concerned with the type of food you have to eat, that you've convinced yourself you have to eat. So again, that is a very brief overview. I encourage folks to listen or to take a deeper dive if they have questions about them, or at the end we can ask questions more specifically about the diagnosis. But those are currently what's in the DSM. Orthorexia is actually not in the DSM yet, and we hope it does make its way there, because we're seeing increased disordered eating behaviors that align very much with its definition. I want to just touch briefly on co-occurring conditions. So multiple studies have found significant rates of co-occurring conditions for those experiencing eating disorders, things like major depression, anxiety, ADHD, OCD, borderline personality disorder, post-traumatic stress disorder, and alcohol or substance use disorder. I will say, qualitatively, those experiencing eating disorders typically will have some, and this is very much a generalization, but what we're seeing is some complex trauma history. There's very much, it's not 100%, but it's very much aligned with eating disorder symptoms. And often what we say, what some clinicians will say is that, and this is not it's not the case for every individual experiencing eating disorders, is that eating disorder symptoms and behaviors are typically kind of the smoke and mirrors that once they're mitigated, the co-occurring conditions, while they can be treated at the same time, will have more room to sort of be focused on and more room to breathe, so to speak, and treatment can really hone in and focus. But there's a lot of intersection between all of these co-occurring mental health conditions and eating disorder treatment. And I want to pass it on to Catherine to talk about myths within the eating disorder field.
Thank you. Yeah, the myth around eating disorders is that they impact only young cisgender white women, but that's not the case at all. In reality, all people can develop eating disorders, regardless of their age, regardless of gender identity or race. And the next slide will share some statistics about who is impacted by eating disorders. And also just want to make known that we don't know often from looking at someone that they have an eating disorder. It's sort of the stereotype that it's someone who's, very, very thin and that you'll be able to look at them and recognize. But in most cases, you don't know if someone has an eating disorder just from looking at them. So, and just to read off these statistics, I'm not going to really go through each one because we don't, we want to keep time for questions. And we have put in parentheses at the end of them where you can find them. NEDA is the National Eating Disorders Association. Is that right? Yeah. And then ANAD, you can find them at anad.org. They're another eating disorder organization. So Black teens are 50% more likely than white teens to engage in behaviors associated with bulimia, like binging and purging. Asian American college students report higher rates of restriction than white peers and higher rates of purging and muscle building than all peers. Hispanic teens are much more likely than non-Hispanic peers to experience bulimia nervosa, and there's a higher prevalence for binge eating in all minority groups. And also transgender college students report disordered eating at 4 times the rate of their cisgender peers. Women with disabilities are more likely to develop eating disorders, and they found that 20 to 30% of adults with eating disorders also have autism. Less than 6% of people with eating disorders are medically diagnosed as underweight. So again, we can't tell by looking at a person that they have an eating disorder in most cases. Most people are not underweight.
Yeah.
The next couple slides.
Essentially, what we want to get across here in all this information and data is that eating disorders are an incredibly pervasive mental illness. They impact every identity and can impact every person. And then from there can impact families, friends, chosen families, really a lot of association outside in terms of people's systems and environments are all impacted. Oftentimes we'll say, eating disorders are systemic within whatever community or environment or family someone is in. So recovery needs to be systemic as well. Just a couple more statistics to point out. Eating disorders are thought to impact over 30 million Americans. I honestly believe this is old data. It's currently what's being, and most national associations will talk about this. I believe that more people than this are impacted by eating disorders. And then beyond that, what's the word impact mean, right? Are we talking about people experiencing the symptoms and behaviors, or their families, chosen families, communities? They are it's a hard, complex mental illness that is undertreated, underdiagnosed, and misdiagnosed. So it impacts millions and millions and millions of Americans and people across the globe. Eating disorders have one of the highest mortality rates of any mental illness, second to opiate addiction. 1 in 10 people experiencing anorexia nervosa do unfortunately pass away, whether that's via, they unfortunately pass away. So it's an incredibly important that we address this. And right now the need isn't being met. It's a deadly disease. And then approximately 10,200 deaths each year are a result of eating disorders. So that's 1 every 52 minutes. This is a really, really acute issue and a really, really important issue and conversation to continue to have throughout all mental health advocacy and all mental health treatment facilities and then providers alike. Some resources we wanted to just share. You can take a screenshot of this if you want. You can also visit our website, navigatingrecoverypodcast.com. This is a few resources. There are many more. These are people that we've either interviewed, talked to, have a relationship with, or just believe to be good resources for those experiencing eating disorders or wanting to find out more information. And I think one of the best resources that we have found as podcast co-host is having the conversation about our experiences. And I'm going to leave this up a minute while I talk in case people want to write these down. Catherine and I have both, we're very open about our eating disorders. We've experienced eating disorders in our history. And so what we wanted to do today was actually have a conversation with each other to provide, I guess, more or less an example of what it would be like to talk about your eating disorder story. There's a ton of shame and stigma associated with having an eating disorder. And it's time to break down those walls because it's not about shame. It's not about blame. It's a mental illness and a disease like anything else that needs to be treated. And so the first step is to, within the medical community and the mental health community, to destigmatize it. And then beyond there, empower people to share their stories when they're ready, right? And by no means are we indicating that go out there and share your story, right? It might be a slow process. You may never be ready, but we want to create space to demonstrate what it would be like. And hopefully people can connect and relate. And that's our goal. And when we podcast. So I'm going to exit this screen. Again, you can find these resources on our website. And our emails are also on there too, if you ever want to reach out to just have a conversation or learn more. We're going to jump into it. And I think I'm going to start with Catherine. How did your eating disorder develop?
It's honestly a complicated story. There are a multitude of factors. And as I've learned from conversations we've had in the podcast, there are a lot of different ways to tell the story, and our understanding of our own story shifts over time. That's something that one of our guests, Vance Goodman, said, and it really stuck with me, that this is how I understand my story at this point in time, but it does change. So on the surface, I would say my eating disorder developed really because of an addiction to dieting. I had gone to college. I had gained weight my first year, which is, typical of a lot of students, and decided that I wanted to try to lose that weight. I'd never really tried dieting before, and it felt great. I felt so good and exhilarated and everything to lose weight and to start a rigorous exercise program and all of those things. And it just took hold. And I want to mention a statistic that's on the NEDA website, and that's that people who diet moderately are 5 times more likely to develop an eating disorder. And those who practice extreme restriction are 18 times more likely to develop an eating disorder. And I say that just for parents or for anyone who might be concerned about their child developing an eating disorder. Dieting is a factor. And when people begin to diet, there's always that risk that it's going to turn into something bigger. And I think, so on the surface, it was sort of an addiction to that feeling that came with dieting. But that developed because of a lot of different factors that I think had sort of the circumstances of my life in college brought all of these things together that I'd been struggling with for years. As a kid, I was always pretty perfectionistic. I was hard on myself. I always wanted to do as well as I possibly could. And was also dealt with a lot of social anxiety, had a lot of insecurity. And I managed fine, through high school because I was in a very supportive environment. I was with people that I had gone to school with for my entire life and had good friends, and everything went well. But then, I went to the most competitive college that I was able to go to, and things kind of fell apart. Or it was like this perfect storm of feeling like I wasn't enough on so many levels, that I wasn't smart enough, that I wasn't good enough to be there. And so all of those feelings kind of came together. And when I, started to realize how I felt from exercising and dieting, it really helped. It was a coping mechanism for me. It was a coping mechanism that helped me deal with those feelings of insecurity and feelings of not being enough. And that's what's so hard about an eating disorder. It was effective as a coping mechanism. It worked. The problem is it's not sustainable. You can't continue to do that without a lot of negative consequences. But it provided a lot of things, provided the sense of achievement. I felt like I was worthy because I was achieving these goals and I was able to do these things. And, it helped me feel like, okay, well, maybe I'm not smart enough and maybe I'm not socially savvy enough or any of these things, but I can be thin. That's something that I can feel like I can compete on some level, or like that can make up for these other lacks that I felt like I had. But it also, at the same time, gave me some sense of control. I mean, that period of life, middle of college is overwhelming because you're transitioning from a kid to an adult. And there's that realization that, yeah, at some point I'm going to have to provide for myself and go off on my own and do all these, get a job, get somebody to pay me to do something, all these kind of scary things. And I felt some sense of control, and also was able to kind of retreat into myself and almost sort of revert to this childlike state. I mean, my body was getting smaller. My whole world was getting smaller. So I was able to feel kind of cocooned and safe from all the things that were challenging. So it's complicated. There are a lot of factors that go into it. And, it's a complicated story that it looks different for everybody. So I'd love for you to share, Francis, how your eating disorder developed.
Thanks, Catherine. And I know no matter how many times we share this, it's always very vulnerable. And we think of something new in terms of our own experience. And so just thank you for being vulnerable and putting that out there and sharing with everybody. For myself, again, similarly, it's complex. What I would say in brief is essentially, I was someone who grew up always with having a larger body, and I still have a fat body. And we live in a world where that's unacceptable. And so I was told at a very young age by my medical professionals that my body more or less was unacceptable. And, my parents were doing what they were told to do. And actually my mom, I think, is listening. Hi, Mom. And we all kind of went through the motions, not realizing how traumatic it would be to have people just tell me that my weight was the problem, rather than looking at my whole health. And really, I was a healthy, happy kid with a lot of ambition and a lot of social skills. And I kept continually was being told that my body was wrong. And body image dissatisfaction is one of the leading contributing factors to developing an eating disorder, which is certainly what happened in my case. As someone who was athletic, I found a space for my body in high school, playing sports. My body suddenly went from wrong to, oh, we need this big body to move around and hit people and wrestle and do all these things. And it really kind of was just a holding space for the impending, continuing, really, from my perspective, disaster of being again told my body was wrong. Once I left the sports arena, once sports were no longer part of my life, my body became, oh, they're not playing sports anymore. You have to decrease. We hear that all the time with NFL linemen, right? Well, now that you're not a lineman, you got to decrease your weight, and many do. And it's really hard. And it is what developed, was probably the main contributing factor to me developing an eating disorder. My symptoms, I transitioned, and that's one thing that can happen with eating disorders. If you're anorexia nervosa at a certain age, doesn't mean you're experiencing anorexia nervosa your whole life. It can transition between different eating disorders, which is certainly what happened to me. And so what I would say is that really the macro societal perspective on bodies and body size and how that equates to health is what was the main contributing factor to not just me in terms of how I felt, but how it was managed medically. And it really was not the appropriate. It was not the right way to do it. Had someone looked at my whole health when I was, 10, 11, 12 years old, a medical professional, I wonder if it would have been different. But people are, and look, there are other contributing factors to needing and desiring a coping mechanism or a way to numb, which was what my eating disorder provided. Ultimately, though, it really was pushed by this fact that I felt unwanted and wrong because of the body I had and continue to have. I mean, I've never been a small individual, and I never will be a small individual. And it's taken a long time to realize that. And I think that, I think that might transition nicely into our next question, which is, what was it like to live with an eating disorder, Catherine?
Yeah. And in some ways, it's hard to answer this question because, I mean, for me, my eating disorder was over 20 years ago. So that's part of it. But also, the experience of having an eating disorder, I felt very cocooned. And I think I used that term before. It's a little bit fuzzy. I mean, my experience itself was kind of fuzzy. I feel like the eating disorder sort of smoothed out like all of the edges. And, so that I kind of lived in this bubble in some ways where I was aware of the people around me. I happened at the time to live in a sorority house, which, is not an easy place. I don't think in general, just being with that many different
Sure.
college age women. And even if there isn't disordered eating, it's hard not to compare yourself, compete, and all of that stuff. And, so I remember kind of going into the house and just sort of like being in this bubble of not really, maybe I would say hi to somebody, but I wasn't really there. I wasn't fully engaged. And I think that's the way in which, the eating disorder was protective in a lot of ways, because it kind of prevented me from feeling much of anything. But I did also feel this, as I mentioned, the sense of accomplishment. I think in some ways it was like really exhilarating, like to be able to, I had a compulsive exercise component to my eating disorder. So, going to the gym and spending time exercising and, and then eating as little as possible felt very, it was exhilarating, and that was addictive. And that, was kind of driving this. That was the only sense of positive feeling that I got, or just the sense that who I was okay. So yeah, it was that kind of cocoon feeling, but then there were those moments of lucidity where I was sort of aware, kind of looking out at everyone else and realizing that I was missing out on things, that, those moments where I kind of realized that the eating disorder wasn't doing good things, even though it felt like it was good for me and it felt like it was protecting me, kind of that realization that it wasn't. And, that's a hard process to go through. I also had I had a really difficult experience where my sorority house, the people invited in a speaker to talk about eating disorders. And I knew that they were bringing that speaker in because I was dealing with an eating disorder. I wasn't the only one, but it was definitely obvious that I was. And in my case, it was clear. But, nobody really wanted to talk to me about my eating disorder, but everybody wanted to kind of talk around it. And so it was this very weird place of kind of being part of normal life, but at the same time being kind of removed from everything. And so, yeah, it was a strange, almost surreal experience. But how about for you? What was yours like?
Oh yeah, I completely agree. The surreal part. For me, it was actually, this is working, and then denial, and then it wasn't working. Right. Eating disorders, I want to be, clear from my perspective. Chastising eating disorder behaviors, demonizing them isn't overly helpful, because for the individual experiencing them, and certainly in my case, it was the only thing that was helping me at the time. It wasn't sustainable at all, and it was going to kill me, and really almost did. But at the time, especially in the beginning, you don't even really realize what you're doing, and no one really realizes what you're doing, and it's confusing and complex. And this is why early intervention and more information, education about it is so important, because early intervention shows extreme efficacy in being able to mitigate behaviors and not actually have full-blown eating disorders, so to speak. But for me, it was a place of peace. It was my best friend. It was what kept me sane. Really, to a degree. And then when it was either pointed out to me or I kind of realized it on my own, like you were explaining, those lucid moments, I just went into denial, because I didn't want to give up that feeling of, oh my God, this feels so good, to numb out, to not be anxious, to not be depressed, to not feel the way I was feeling, to not think about what I was thinking. it was my go-to, right? It was like, this is what I need. And I had no other real coping skills, right? And therein lies the need for treatment or need for support or whatever it was going to look like for you to learn those strategies to find recovery. And then it became a disaster. It became clear that it was a problem, that it was going to harm me. It was harming me. And it was going to kill me. And it wasn't until the end of I mean, I had an eating disorder probably for much of my life, but certainly for 10 years where I can really think about it and say, oh yeah, eating disorder symptoms were present. It wasn't until the last year really where I was like, oh man, this is a problem, and I need help, and I didn't know where to go, what to do, and I guess I want to kind of transition to the next question because we're going to talk about that, and that's is like, how did you find recovery, and what do you do on a daily basis to sustain it? And I actually want to start with you.
Yeah, I feel like early recovery was even more of a blur than the actual eating disorder. It's even harder to kind of remember. But in one thought that comes to mind, this is something that one of our interviewees, her name is Jess Springle, she's a therapist or clinician. One of the things that she had said is that you don't have to really want recovery in some ways. That I'm paraphrasing and I'm probably not doing it very well. But essentially, the thought is you don't necessarily have to have the hope for recovery. Somebody has to have it for you. And I will say that a huge part of my recovery was that there are lots of somebodies who had a lot of hope for my recovery. And, I prayed for me, supported me, did whatever they could do to help me, get to the other side. So that played a huge role. And I'm very grateful for that. Yeah, I mean, I think there are a lot of, as the eating disorder developed from a lot of different factors, there are a lot of different factors that led to recovery. And I mean, honestly, one of the biggest motivating factors for me was my sister had her first baby, and I went with my dad to visit her and, see the baby. And she was named after me. Her middle name is Catherine, which is really wonderful. And it was just one of those moments where, I realized I cannot keep doing what I'm doing if I want to ever experience that. And it was, that was what I wanted more, excuse me. It's what I wanted more in life than anything else, was to be a mom. And so that, I mean, honestly, that played a huge role. It was very motivating, and it was something that I sort of kept in mind. And in some ways, I feel like I applied the same kind of willpower maybe to recovery as I did to continuing my eating disorder. But I also hesitate to say that because willpower alone can't really get you through recovery. And being able to reach recovery doesn't mean that you're better or you have more willpower than somebody who isn't able to. I mean, it's difficult, and there are a lot of factors involved. I feel like I'm answering this in a very vague way because it's a hard question to answer.
It is.
I didn't go to any kind of treatment. I didn't even see a single therapist. And I do think that was a mistake. I think that while I was able to get myself nourished again, and I was fortunate because my eating disorder it was intense, but it didn't last a really long time. So, I think in some ways it was a little bit easier to get out of it, but I was definitely able to nourish myself and, be able to live fairly normally. But it took a very, very long time to get rid of some of the disordered attitudes I had that I didn't even realize were disordered because they're so common in our culture. I mean, everybody, well, no, I'm generalizing. That's not true. Not everybody, but so many people talk about food and their bodies in disordered ways. So it took a very long time to realize that my habits were disordered. And it wasn't until, I put together a book of essays about eating disorder recovery, and Frances contributed. And then we started this podcast that I feel like I've finally kind of reached the last points of recovery. And I think I would have gotten there a lot sooner had I worked with a clinician. Some of the people that we interview who, are young or are fairly fresh out of recovery, and they're so wise and they have so many amazing insights from working with people like you, Francis, and other clinicians who can help them figure out what's going on and, how to reach recovery. So that was a not terribly direct answer. I hope that it was helpful. But how about you, Francis? How did you find recovery?
It was kind of three or four pronged, really. To be honest, I kind of had a conversation with my partner at the time, and that was kind of what brought it to light. Kind of reached out to a treatment facility. They were able to take me right away, of course, as a lot of people who aren't ready for treatment do. I said, "Oh, I'll start in a month or two." My parents were emotionally and financially supportive of treatment and there for me. And then I had a colleague who was said, "Do what you got to do." And I think that I feel a lot of privilege in that, and a lot of gratitude in that, and that I had all of these things kind of work in my favor to get treatment, which I recognize is really not what everybody has. So I feel very lucky in that sense and very privileged in that sense. And I went into an intensive outpatient for 3 or 4 months, 5 months, whatever it was, and that was the foundation of my recovery. And I do things every day to maintain it. I am no longer, consider myself in full recovery. And what that looks like for me is I still have days where I hate my body, and that's okay. I still have days where I feel like if I enacted a behavior that would make me feel better. Of course it would, but it's not sustainable, right? So for me, it's having a very realistic conversation with my eating disorder, to coexist with it and not to shove it in a closet where it's just going to grow uglier and meaner. And that's what I learned in recovery, right? That we're not, eating disorders aren't bad. They're mental illness and they need treatment. And part of the treatment is learning to coexist with it and not let it have so much power over you, and to actually manage how you're feeling, manage what you're thinking, in a way that's realistic and reasonable, and not having to numb out or cope through this maladaptive behavior or whatever it may be in your eating disorder experience. So for me, it's pretty straightforward, right? Like, I had an eating disorder for 10 years, went to treatment. That was the foundation. And while I had what I would call mini relapses, if you want to call them, I think I had a client once call it opportunities of growth. And I really, really love that sort of reframing. And I've gotten to a point, years later, where here I am, right? The eating disorder is still present. I mean, the voice is still there occasionally, but it's way quieter, way less frequent. And for me, the main coping skill I have is just that Socratic questioning, like, what is this actually going to do for me if I enact a behavior? What is this actually going to do for me if I obsess over my body? Nothing, other than drive me deeper into a hole that I existed in. So, that's my short story. Again, I did contribute to Catherine's book, and there's more detail in there. It's an amazing compilation of stories that were similar to this that we're sharing here. And then, how I maintain it. I want to jump to our final question of our interview, Catherine, and what have you learned about eating disorders and recovery over the past year from the podcast?
Yeah, I have learned so much. And I had a lot to learn. I mean, I guess I've learned just how complicated eating disorders are, and that just how different they can look for different people. But at the same time, how many opportunities there are for connection, even with people whose eating disorder was very different. I mean, we have these conversations, and it's amazing. I mean, I feel so much connection, which is so valuable for mental health. That's something we haven't touched on that much, but eating disorders are incredibly isolating, and they thrive in isolation. So being able to have connections is really so valuable. I think that's the most important thing. And also just that having these conversations regularly is really helpful. I think for so long, I didn't want to talk about my eating disorder, and I didn't talk about it for a very long time. I didn't want to talk about anything that I struggled with or that I felt bad about, because, I felt like I needed to hide that away. But it just grows. Those dark feelings grow when you don't shed light on them. So that's been a really valuable lesson, to know that having these kinds of conversations, talking to people about their eating disorder, has a significant impact. And whenever I feel like I'm struggling, or might want to enact a behavior, or kind of just start going down a path that isn't healthy for me, I'll remember a conversation we had, and it just completely shifts my my mental frame of mind. How about you? What have you learned?
I've learned that we live in the gray, right? None of this is black and white. We oftentimes you hear recovery is nonlinear, which is very true. And mostly that it's you live in the gray. Things are going to be challenging one day, less challenging the other. And to begin to, I've had to learn to accept that even this far into my recovery, that if things aren't black and white and never will be in terms of my recovery. And so living in the gray is what I'm doing. And I've taken that knowledge from our guests mostly because they're all living in the gray. And it's pretty remarkable to hear them and their stories as well because of how unique they are, but also the themes throughout everybody's story are that you can pull themes out. Another thing I've learned and really embraced is that everybody's health is their own. And too often, and one of the major contributing factors to developing eating disorder is what I talked about in my own story, where a doctor tells you you need to lose weight. Okay, well, how come? Right? Begin to ask questions about your health that are less determined about one vital sign. We have a lot of trust in our mental health and medical communities and practitioners because we should. But know that you have the right to understand what your health is, and no one else, especially outside of the mental health and medical professions, can dictate that. So the next time someone says, "Oh, I know this diet that you should go on," okay, don't take that in, right? Are they a dietetic nutritionist? Probably not. Um, but everybody has an opinion on everybody else's health. Your health is your own. And certainly, weight is one of many vital signs as a part of your overall health. And I've had to take that to heart and realize that because for a long time, weight was the only vital sign I cared about. And it nearly killed me. So clearly focusing on it was the least healthy thing I could have done. So those are really two of the things I've taken away from our interviews, from this podcast, from just having these conversations for the past year in the middle of a pandemic where we've seen the acuity of eating disorder symptoms and behaviors increase at a rate. We will know the number one day, but it is really high because the world tells us we have to look a certain way, and we certainly just don't. How you look is perfect no matter what it is, and it's supposed to change over time. I had someone share with me the other day, like, they were in their 50s, and I think Connie Subject talks about this too. She's a body image expert, and we interviewed her early on that a 50-year-old body is just not biologically not going to or supposed to look like an 18-year-old body. It's not feasible. And yet that is the mindset that's been drilled into particularly females and femme presenting individuals, but also across the gender spectrum, right? That we have to look a certain way. Otherwise something is wrong with us. So I've really taken those two things into heart. We live in the gray, and your health is your own. And I think this is a good place to pause. And I'm glad we had the opportunity to talk to one another and share our stories again. Every time we do, it's vulnerable. And I hope that people feel some sort of relatability in some of this or connectivity in some of this. And we wanted to open up to any questions if there are, and if there aren't, that's okay too. But we're here to listen and talk.
Okay, so I'll go ahead and lead off. If someone is concerned that they may have an eating disorder, what should they do? Where can they seek help for that?
I think you're better equipped to answer
okay,
than
absolutely.
I am. You are the clinician.
Well, I mean, there's a number of things. First, I would say if you're someone experiencing eating disorder symptoms and you have someone in your life that you trust and that is supportive, which not everyone does, I would go to them first. Allow yourself to just share what you're feeling and what you're experiencing, to get it out of your system. And so that it's no longer just living inside you. So if there's someone in your life, more clinically, if you feel like you're experiencing eating disorder and you're looking for treatment or an assessment, you can search for eating disorder programs in your area. And most places will do a free assessment of your behaviors, of your symptoms, and talk to you about your experiences. And there you can actually receive a diagnosis and a clinical recommendation for care. So you can, in most places, will have a licensed clinician having this conversation with you. And they can, at the very least, give you recommendations of what clinically they would recommend in terms of level of care. And there are various levels of care, all the way from weekly outpatient with a specialized eating disorder clinician, all the way up to inpatient, which is for highly acute patients who are individuals who are medically compromised, potentially need refeeding. There's more specifics to that I don't want to jump into at this point. So that's where I would start, talking to a support, and then reaching out to professionals, mental health professionals and medical professionals. And, if you feel like you're medically compromised, go see your doctor, go see a doctor, get your blood work drawn, get an EKG. They'll let you know if there's deficiencies in any of that. If there's any red flags, for parents who have kids and kids oftentimes can't verbalize what they're going through. But if you see this and observe it, take them to their pediatrician, take them to a pediatrician, have them assessed. That's where I would start. There's lots of concerns and problems that are being worked through in the assessment process, but that's where we can start right now. Catherine, would you add to that?
I was just going to say, for people who are in Virginia, I would go to the Stay Strong Virginia website. That's an organization that was started by Beth Ann Stansfield. We interviewed her on the podcast. Her daughter had an eating disorder and she couldn't find the support that she needed. So she created an organization to provide that for other people. So that's a very helpful place to go. They have a list of clinicians, I think dietitians, as well as therapists who specialize in eating disorders. And then there are a lot of good support groups. So that's a great resource.
Okay, so with the stigma of mental illness being so high, does an eating disorder being described as a mental illness negatively impact someone's chance of seeking help?
That's a good question.
We're trying. Yeah, that's a great question. And I think objectively, anytime anybody's diagnosed with a mental illness, the stigma is there. So potentially it could lead to barriers in accessing treatment, whether that's the community or family you're in saying you're not sick enough or you don't have a mental illness. And that's what we're trying to actively end and advocate against. There is no shame in having a mental illness. Many people in this country, in this world, have some level of mental health problem or mental illness, and it's a completely typical experience for so many people. So I think objectively, I would say, just to be fair, sure, in this current environment, it may lead to barriers in accessing treatment. However, I would really encourage the individual who asked that question and everybody to consider that what the outcome of not seeking treatment, regardless of what your supports indicate or what the stigma is, would be for you. So take some, I know it can be challenging, but take some of that, empower yourself in seeking out and going beyond that stigma and realizing that just like a cut needs a Band-Aid, which is not a great analogy, I understand that, or just like cancer needs treatment, eating disorders need treatment, and you need to heal from them. And so that's how I would equate it.
Okay, we have any other questions for our presenters?
There was one in the question box, Jim, that it was a pretty specific, what's the difference between ED and OS and OSFED? That changed in 2013. The initial diagnosis was eating disorder not otherwise specified. And I don't know the exact answer for that. They did change it to OSFED, and then they also created UFED, unspecified feeding and eating disorder, I guess to create more, because there's some criteria that is met in OSFED. For example, like atypical anorexia, which is essentially anorexia nervosa without the weight criteria that anorexia nervosa has. So I think it was a way to create two more non-specific eating disorder diagnoses, but I will stop there because I'm not overly familiar with the reason for the change.
Okay. So we had the question, if you are overweight, do you have an eating disorder?
Short answer is no. You do not necessarily, right? Eating disorder behaviors and symptoms are specific. Things like restriction. Are you skipping meals intentionally? Are you purging nutritional intake at any point, and specifically over a period of time? Are you binge eating, which is a quote unquote excessive amount of food, or eating past fullness, feeling out of control and powerless when you do that? Those are the symptoms and behaviors we look look for at any body size. So if someone has a larger body, and I'll be very frank, and I don't use the word overweight because that indicates that there is a normal weight we all should be, and I disagree with that notion. And so what I would say is people who have a larger body or have a fat body, no, you do not have an eating disorder necessarily. If you're experiencing some of the symptoms and behaviors we've talked about, certainly warranting a further assessment and a look into how come those behaviors are being used. I don't know, Catherine, would you add anything to that?
No, and I think I misunderstood the question at the beginning. I thought they were asking, can you have an eating disorder and be quote unquote overweight? Which the answer to that is yes. I mean,
absolutely.
But I think I don't think that was the essence of the question.
Yeah, and I'll just use my personal experience. I'm someone who was I had a fat body and was restricting, and I had everything that met anorexia nervosa except the weight qualifier, which again is the fat phobia within the DSM. So absolutely, you can have a body that is large or fat and have what is considered atypical anorexia under OSFED, but really anorexia nervosa.
Okay, so we don't have any more questions in the chat, so we'll go ahead and bring it to a close for today. Thank you to Catherine and Francis for joining us today and helping us discover more about our world. Please join us next week on Wednesday, June the 9th at noon for the Total T-Rex, the latest science on the world's most famous dinosaur, presented by Dr. Thomas Holtz, Principal Lecturer at the Department of Geology at the University of Maryland. You can register for next week's talk at smv.org. Each talk is free to attend and is open to the first 300 registrants. Thank you again for joining us today. Until next week, stay safe and stay curious. Thank you all for being here.